According to the United Health Association, Louisiana ranks 49th in population wellness. The leading indicators are low birth weights, children in poverty, obesity, and cardiovascular health. If that wasn't enough, in the past 5 years, drug-related deaths alone have risen over 65%. Currently, Louisiana has led the nation multiple times in COVID-19 cases per capita. In fact, several of the hardest hit long-term care facilities have been right here in District 3. And while they have survived, my own mother and father were among some of the first cases right here in Calcasieu Parish. And so we mourn with the thousands of families that are grieving the loss of their loved ones all across this state, this nation, and the world. And I pledge as your next congressman to not only address the current crisis, but to continuously work towards the eradication of our persistent vulnerabilities with both competence and compassion. The ignorance of our realities is not bliss, and denial is not the antidote. We cannot defeat foes that we are too afraid to face, and our current state of healthcare has proven to be fatal. So here's the plan. First and foremost, we must increase testing nationwide and increase the access to rapid testing for all of those who live in congregate settings and learn within their classrooms. 5 to 7 days for results is simply unacceptable as we try to save lives through contact tracing. Next, we must recognize and reward every healthcare warrior on the front lines of this battle with both hazard stipends as well as student loan relief. No one that is risking their lives to help us defeat this disease should be drowning in debt from obtaining the skills essential to fight it. And it is absolutely unacceptable for there to be a healthcare worker working anywhere in this industry without having healthcare insurance for themselves. Then we must expand healthcare to all in an effort to ensure the sanctity and quality of life for every single American from gestation to geriatrics. We must emphasize and incentivize the expansion of both telehealth and outpatient health in order to ensure midwives and skilled nurses can lead the charge in keeping people healthy within their own homes at the lowest cost possible. We must also invest in rural and community health centers to ensure that both health education and rehabilitative services are led by those that know the needs of our citizens best. Last but not least, we must reinvent our phenomenal cuisine in ways that do not allow them to become our fatal flaws, so that we can eat, drink, and dance our way back into shape and truly show the world how to laisser le bon temps rouler. And these are just a few ways that we can form a more perfect union.